Welcome to this Zoom meeting where we're going to introduce you to 4 experts who will show you that higher blood levels of vitamin D, which is a potent steroid pro-hormone, not just a nutrient, can help to reduce your risk of catching any coronavirus or reduce the severity of the illness. I had the pleasure in 2011 of hosting a conference where 3 of these people spoke. And the first one is Michael Holick, Bill Grant, and then David Grimes. So this is our agenda for today. Let's continue. Now, who is the target audience for this? We'd like to show this to the experts, and I'm based in the UK, in NICE and SACN and so on. These are the people advising the ministers. And we'd like to show it to the politicians, any doctors and nurses and other medical people, that's great. Health insurance companies would benefit from understanding this. And of course, it's for everyone. Now, they're going to be, in case of confusion, the Americans use nanograms per mil. And in the UK, we use the SI units of nanomoles. So in the UK, we have a definition of deficiency that is set by the Department of Health, probably to save money, which is 25 nanomoles or 10 nanograms. America has 20 nanograms. There's very good evidence that for good bone health, you need 30 nanograms. And there are some experts who issued a call to action who say that they think that the level ought to be, the optimum level is between 40 and 60. Without any further ado, let's go over to Michael Holick and hear from him.
I'm Michael Holick, professor of medicine, physiology, and biophysics at Boston University Medical Center. And my goal is to give you a very broad overview about the important role of vitamin D for immune function. And this has particular importance in light of the COVID-19 pandemic that has now swept the world. And as you're well aware, there's been a lot of hype about vitamin D. And there's been a lot of skeptical conclusions about vitamin D. And I'd like to give you some perspective about it, and then also to discuss with you some recent studies that we have that hopefully will convince you that there is no downside to improving your vitamin D status, but there's a major upside if these observations turn out to be replicated. And so, is there any benefit that vitamin D can provide during this pandemic? And so vitamin D, as you're well aware, is the sunshine vitamin, comes from exposure to sunlight. And once you make it in your skin or you ingest it in your diet, it then goes to your liver. That's converted to the major circulating form, 25-hydroxyvitamin D. And then it goes to your kidneys to get activated to 1,25-dihydroxyvitamin D. And we now recognize that basically every cell and tissue in your body has a vitamin D receptor. And so vitamin D plays a very important role for overall health and welfare. And so what are those functions? The earliest observation was made by Dr. Suda back in 1979. He realized that leukemic cells had a vitamin D receptor. And when he incubated them with active vitamin D, he showed that they became mature. And so the obvious question is, what is the function of vitamin D on your immune system? And we know from early work that I had participated in back in the 1980s that B and T lymphocytes have no vitamin D receptor, but only when they get activated do they develop a receptor. And once they have that receptor, they now interact with the active form of vitamin D and have a wide variety of effects on cytokine production. And as you're aware, the cytokine storm is a major cause for morbidity and mortality associated with COVID-19. And for B cells, which make antibodies, we also know that they get activated and they will recognize active vitamin D, and that active vitamin D does regulate antibody activity and immune function. We also know that the cells that gobble up your bacteria and viruses, known as macrophages, when they get activated, they activate vitamin D. We've always known that vitamin D has been important in helping to fight infectious diseases like tuberculosis. Here in 1849, for example, cod liver oil containing vitamin D helped in reducing some of the consequences from tuberculosis. Vitamin D protects against TB. In 2006, a major discovery was made when we really understood how vitamin D is playing a role in these cells. It was Maudlin, Adams, and Liu who showed that if you take a macrophage and, for example, have it infected with tuberculosis, toll-like receptors are turned on. Why? It tells the cell to activate vitamin D. Why? Because active vitamin D tells the macrophage to make a protein called cathelicidin, which specifically kills infectious agents like TB and the coronavirus. And so it was well documented here in 1924 that exposure to sunlight was important for patients with TB. But we also know something else. It's always been interesting and curious that it's always in the wintertime that we're most affected by flu. And Hope Simpson in 1981 had suggested that there's a seasonal stimulus. What is that? Well, one possibility is that at the peak flu season, your blood levels of 25-hydroxy vitamin D, the measure of your vitamin D status, is at its lowest. There's a lot of association studies here from the third National Health Nutritional Survey. They showed that the higher your blood level of 25-hydroxy vitamin D, lower was your risk for upper respiratory tract infections. Here, a study done in Yale showed that the higher your blood level of 25-hydroxy vitamin D, on average 38 nanograms per ml, close to 100 nanomoles per liter, reduces by twofold upper respiratory tract infections. Study done in Japan, they gave school children during the winter 1,200 units of vitamin D a day and showed reduced risk of developing influenza A infection by 42%. So what is the evidence that vitamin D can improve immune health? So we did a study several years ago and asked the question, how does vitamin D affect your genes? And we took healthy subjects that were vitamin D deficient. We gave them 2,000 units of vitamin D a day for 12 weeks. And we looked with chip analysis at almost 23,000 genes in terms of their expression. Long story short, all of these blue lines are underexpressed genes, and all of those orange lines and red lines are overexpressed genes. And this is an individual before getting vitamin D, 291 genes. After getting vitamin D, we were able to markedly reduce the high expression and markedly increase those that were low expression. Well, you may ask the question, what is the impact? Does it have any benefit? And so we then looked at those genes and we showed that more than 80 different pathways are influenced simply by taking your vitamin D. DNA repair, apoptosis, which is cell death, killing cells that potentially become malignant, oxidative stress, metabolic processes, and most important, anti-inflammatory activity. We've known for more than 3 decades that your immune cells recognize active vitamin D, and this shows very nicely all of the interactions that occur by improving your vitamin D status on your immune function. Indeed, it's been demonstrated that a major effect is on cytokine production by immune cells, and it helps to modulate their production in a positive manner. And so is there any evidence that higher doses can improve health? Well, there are a lot of data that we've also published to show over a 6-month period of time that if you take 600 units a day versus 4,000 units a day versus 10,000 units a day, those on 600 units a day up and down regulated a few hundred genes, but those on 10,000 units a day were able to regulate more than 1,000 genes in a positive way. So what about vitamin D in the coronavirus, right? We know we have innate immunity and adaptive immunity, and vitamin D plays a critical role for both of these, right? And so for innate immunity, you're looking at activated macrophages and dendritic cells, and for adaptive immunity, it's the lymphocyte activity. And so 125 dihydroxyvitamin D, the active form of vitamin D, helps to regulate all of these processes. And so the cytokine storm is a major complication from having COVID-19 infection. And there is a lot of evidence that is now suggestive that if you're looking at what's called CRP, C-reactive protein, a major protein that's related to inflammatory activity, a very nice study early on had suggested that there may be a decrease in CRP and that this may help in reducing cytokine storm. And so this is a major issue. And can vitamin D really do this? And so many different perspectives have been looking at the role of vitamin D in regulating immune function. And it does it in a variety of ways through the vitamin D receptor. And we also know that, like I said, macrophages, dendritic cells all respond to vitamin D. We also know, curiously, that this virus is very clever and is able to get into the cell through this called angiotensin receptor. And we now recognize that the active form of vitamin D regulates the production of angiotensin. And so it could be that active vitamin D will, in fact, help reduce risk of acquiring the infection if you can improve your vitamin D status. And so there's a lot of information to suggest this. But the question is it really true? And so we did a study. And we looked at 191,000 blood samples from throughout the United States for COVID-positive patients and asked the question, if they have a blood level that is higher, are they at reduced risk of acquiring this infection? And we just published in PLOS1 on September 18th that if you look at this slide, it's quite remarkable. If you look at 20 versus 55 or 60, you can see that there's about a 54% decline in risk of acquiring this COVID-19 infection. So simply by being vitamin D sufficient reduces risk by 54%. Whether we looked at northern or southern latitudes in the United States, the effect was still the same. Also, African Americans and Hispanics are particularly high risk for many of the complications from COVID-19 infection. And we've shown now that African Americans and Hispanics, because of their dark skin coloration, reduces their ability to make vitamin D in their skin, higher risk of vitamin D deficiency and higher risk for acquiring this infection. We also looked at age. And even though we're worried about elderly and being more prone to the complications, we showed no difference. We also looked at males and females, no difference. So across the board, the higher your blood level of 25-hydroxyvitamin D, lower is your risk for acquiring this infection. We also now just released on September 25th our latest study. 235 patients admitted to the hospital with COVID-19 infection. 70%, actually 74%, had severe disease. And we asked the question, what is their blood level of vitamin D? And does it have any impact on the consequence? And so, and as you can see, we're starting to now get a fair amount of publicity about this. Implying that improving your vitamin D status could have a significant impact here, reducing risk of infection by 54%. So in this PLOS1 article, we showed a couple of, made some observations. The first is we looked at severity, we looked at unconsciousness, we looked at hypoxia, an ability to obtain oxygen and have consequences, and we showed that, in fact, If you're vitamin D sufficient, much less likely to have these complications. We also looked at C-reactive protein, right? It had been speculated that C-reactive protein is lower at lower latitudes. We now have evidence that CRP is lower in patients with the infection and having higher blood levels of 25-hydroxy vitamin D above 30 nanograms per ml, 75 nanomoles per liter. We also looked at lymphocyte count, because if you have higher lymphocyte count, that also helps you in fighting this infection. And we showed, again, those that were vitamin D sufficient had higher lymphocyte count. So we have good evidence for patients in the hospital with severe infection. If they're vitamin D sufficient, they're less likely to be unconscious and less likely to have many of the immunologic cytokine storm type of activity associated with it. We also asked another question. What about relationship of their vitamin D status and risk of dying? What we found remarkably, and it's consistent with lots of observations, right, is that mainly older adults are at higher risk for death. And that's what we observed as well in this hospital population. We showed under the age of 40, we didn't see any deaths. But over the age of 40, the higher your vitamin D status, lower was your risk of dying from this infection. So should we be testing everybody? I'm not going to bore you with the details, but as hopefully I'll convince you in a moment, vitamin D is one of the most non-toxic fat-soluble vitamins, contrary to popular belief. And here's a very nice study showing just loading doses of really huge amounts of vitamin D had no negative consequence. So how do you treat it, right? Well, when your gas tank is on empty, do you get a liter or a gallon of gas? No. So we started back in 1998 and showed that if you give 50,000 units once a week for 8 weeks, equivalent to about 6,500 units a day, we're able to correct vitamin D deficiency with no problem. And then what do? So we keep our patients on 50,000 units every 2 weeks. It's equivalent of 3,000 units a day, and they remain sufficient. The question is, if you're going to be on this level for such a long period of time, is it going to cause toxicity? Because maybe a couple of months or even a year, you don't really know. So we did the study, and we did a 6-year study following these patients, on average taking 3,000 unit equivalent a day. No one was toxic. They were in the preferred range of 25-hydroxy vitamin D of about 40 to 60 nanograms per ml, which is about 100 to 150 nanomoles per liter. And so do you need to do screening? And the answer is no, because we showed very nicely. I took all my patients and put them on this dose without testing their blood level. And we showed that there was no toxicity in a clinical setting. And so whether you start out at vitamin D deficiency level or even sufficiency, on these doses will not cause toxicity. And what about vitamin D2 versus vitamin D3, right? We showed many years ago it doesn't make any difference. More importantly, what we also showed was in healthy adults, if you take 1,000 units a day, you will not become sufficient. Will you become toxic? Long story short is, we and others have shown you could take up to 10,000 units a day and not worry about toxicity. Here, a very nice study done in Canada showed that adults taking up to 20,000 units a day, they were not toxic in any way. What about children, right? Study was done by Catherine Gordon and showed you could give children 50,000 units once a week for 6 weeks to correct their D deficiency, and 2,000 units a day. Pregnant women, the same thing, up to 4,000 units a day. Hollis and Wagner showed no toxicity in serum calcium or urinary calcium. But you can become toxic. We wound up with a patient that had bought a product on the internet. He thought he was taking 1,000 units a day. The company forgot to dilute it. He was taking 1,000,000 units a day. This will cause toxicity. And so we treated him, and as a result, quickly recovered his calcium, and blood level of 20-hydroxy D gradually came down. He had no complications from this experience. It's difficult to become vitamin D toxic. Feed your genes right with vitamin D, right? We need vitamin D from birth until death, right? With this COVID outbreak worldwide, we know vitamin D deficiency is common. So how much do you need? We know from a very nice study in Maasai herders and Hasta in Kenya, their blood levels on average are 40 to 50 nanograms per ml. How do you get there? You would have to be on 4,000 to 5,000 units a day. And so the other obvious question is, what about the goal? The goal should be minimum 75 nanomoles per liter, 30 nanograms per ml. Prefer range based on our published studies, 40 to 60 nanograms per ml, 100 to 150 nanomoles per liter. This is likely where your blood levels lie, right? We showed 1,000 units a day for an adult will not make you sufficient, right? Adults at a minimum 2,000 units a day. Children should be on 1,000 units a day. Best source, of course, is sunlight. But how much time of day, season of the year? In the UK, you can't make any vitamin D from about October until next April, right? And so we developed an app that's free, dminder.info, and it'll tell you when you can make vitamin D, how much you can make, and it warns you to get out of the sun so you don't get a sunburn. What do? Sun protection on my face, but not on my arms and legs. And I take 6,000 units of vitamin D a day. My blood level, 72 nanograms per ml. Right? Vitamin D deficiency is probably the most common medical condition. And we just published in Nutrients a review article on this. And if you look at this, right, for immune function, vitamin D plays a critical role, including reducing risk of acquiring COVID-19. There is no downside to increasing your vitamin D intake, right? You don't need to be a genius to know this. We need sensible sun and vitamin D supplementation to maintain a good vitamin D status in order to fight this viral infection, right? This is not a hypothesis, right? Vitamin D is important for your health. And I thank you very much for your kind attention.
Thank you all for those great presentations. I'm Rufus Greenbaum. I'm a citizen scientist. I'm interested in preventive health. And as a result of some of my work, my inner age is my real age minus 18. As a scientist, I understand the difference between hypothesis and RCT evidence. I've been corresponding with the UK government about vitamin D since 2009. If you want to see my original letter, follow that link, ISGD RG SACN 2009. I had the great honor and privilege of organizing 4 conferences about vitamin D in 2010 and 2011. And again, you can see those if you look at this link. I currently publish the blog, vitaminduk.com, and I have been commercially involved since 2015. You have to take that into account in what I'm saying. Now, here is the annual blood level of vitamin D in a UK population over a 2 or 3 year period. And you can see, and this is all white-skinned people. These were people born in 1958, and the test was done in 2002, 3, and 4. At the end of the winter, their natural blood level was 35 nanomoles, and it rises to 75 nanomoles in September. It's September the 24th now. This week, we've passed the autumn solstice, and the blood levels will start falling. Now, what do you need to do with vitamin D? It depends on your target. If your target is 25 nanomoles, which is the current UK definition of deficient, well, there's no problem. No preventive action required. If, on the other hand, it's 50 nanomoles, there's a minor deficiency for a few months. And again, there's no major preventive action required. But what if you set your target at 75 nanomoles? Well, now everybody in the UK is deficient all year round. Now what do we do? And if you follow the experts' guidance, that says we ought to have 100 to 150 nanomoles. Everyone is very deficient all year round. Now, what action is required? And what that means is you have to go from our UK definition of 25 nanomoles up to 100 to 150. You actually have to increase the blood level by 4 to 6 times. This is the A plot from Scotland. Look how low they get. In February, they're down at 10 nanomoles, and they don't get much above 45 nanomoles. They've got a problem in Scotland up at 56 to 57 degrees north. 2 key facts. If you want to understand the importance of vitamin D, you need to accept these 2 key statements as facts. If your blood level is less than 100 nanomoles, then you are liable to suffer from some of 88 different health conditions. And vitamin D is a potent steroid prohormone made in your body from sunlight or supplements, and very little can be obtained from food. It is not a nutrient. Second, go away. It's nothing to do with you. Many doctors have been wrongly taught that only a very low level of vitamin D is required, and it's only to avoid problems with bones and muscles. If you persist with this belief, you'll probably reject all the assertions of our speakers and the evidence that higher levels are needed for better health. So read more about it. Here are some links. Follow my blog and Grassroots Health and Vitamin D Wiki. Health outcomes, very good evidence that people with dark skin have lower blood levels of vitamin D than people with light skin. And then when their levels are equalized, then their health outcomes become similar. And this explains why people with darker skin have worse outcomes. Follow that link to look further. If you live further away from the equator than 30 degrees north or south, then you cannot make enough vitamin D from the sun all year round. And in your winter, you will need to find another light source of UVB or take vitamin D supplements. Again, have a look at the shadow rule. There is a delightful talk on TED by Professor Nina Jablonski about the effect of health and skin color and migration. A beautiful talk. Many people who live an outdoor life near the equator, like the Maasai warriors or Hawaii lifeguards, have natural blood levels of 100 to 150 nanomoles. There's an American doctor who walks on a Florida beach every day without a shirt, and he has a vitamin D level of 117. My test results, I take 5,000 IU of vitamin D each day. My last test was 143 nanomoles. But look down the bottom of this slide. The test lab said greater than 50 was adequate. So my doctor's going to look at this and say, you're okay, you're well over the amount. The test labs, DEQUIS in the UK, have to adjust the test result adequate level to be greater than 75 and preferably above 100. How much do I need? How much vitamin D do I need to raise my levels to the lower limit of 100 nanomoles? In winter, I need 4,000 IU a day. In summer, maybe only 2,000 a day. It may be that people are more compliant with a weekly supplement. That's good enough. Obese people should increase the dose, maybe double required. Vitamin D is fat soluble. Larger people have less. Those people who cover their bodies should take the full winter dose all year long. Muslim women, religious people who cover their bodies. If you don't take a loading dose, it may take 90 to 120 days to stabilize. The dose response varies for about 10% of the population. Have a look at Grassroots Health to see a study of people taking large doses. And it's required for life. Many doctors think it's like iron, where you only need a one-off top-up. No, you need it for life. And maybe whole families should be tested or supplemented. Well, what are the next steps? Well, let's monitor and supplement vitamin D levels to greater than 100. The benefit to cost is massive for people at risk. It's an easy, hard challenge. Every step is easy, but making it happen everywhere is hard. Who needs to take action in the UK? Our experts need to understand this properly. NICE, SACN, NervTag, SAGE, and Public Health England. Our politicians need to understand it, and our blood test laboratories need to understand it. Who can take local action? Every doctor and nurse can take action today. Pharmacists can take action today. Public health directors need to understand this and take action. Unfortunately, not all public health directors are medically qualified, but they ought to ask some of the experts for guidance. Health visitors and midwives can make a massive difference, and so can care home staff. And think about what would be the benefit for health insurance companies. The major ones in the UK are Bupa, PPP, and WPA. They would benefit from wide supplementation. Their clients would live longer and pay them premiums for a longer time. So for more information, look at the scientific information on the tolerable upper intake from the European Food Safety Agency. Follow that link. Look at the experts' call to D-action on grassroots health. And for proof that vitamin D works, have a look at Vitamin D Wiki with the section Proof that Vitamin D Works. What are the next steps? Who needs to take action? Everyone. What do you need to do? Boost your vitamin D to 100 to 150 nanomoles. Why? Because you'll live longer in better health. Where do you need to do it? Everywhere. And when do you need to do it? You need to do it now. You want to learn more? Look at my blog, Vitamin D UK. Look at Vitamin D Wiki. Look at Grassroots Health. And vitamindAssociation.org events has videos from my conferences from 2011. I'm very proud of those conferences. They were videoed, they're up on YouTube, and they are a great learning resource. Thank you so much.